My name is Alison Infante, and I will be your presenter today. This academic talk is organized by the Academic Subcommittee at the Dundee University Latin American Society with support from the Dundee University Institute for Social Sciences Research. We also thank Ms. Maria Elena Ramirez from Aldeas Infantiles SOS Bolivia for being our speaker today. Before we begin, if you could please turn off your camera and microphone throughout the event. If you have any questions during the talk, please write them on the chat and we will address them during the Q&A session and at the end of the event. Please bear in mind that this event is recorded. So first of all, I would like to thank the Academic Subcommittee for organizing this event. This is our third academic talk as part of our current project series called Monitoring COVID-19 in Latin America. Our group has dedicated the past 19 weeks to collecting and sharing information on how Latin America is being affected by COVID-19. Today, we warmly welcome Ms. Maria Elena Ramirez, who's a specialist in human rights and development, as our expert speaker from Bolivia. She works at the international NGO Aldeas Infantiles Bolivia as a head of local development projects. This NGO is specialized in children's rights with a primary mission of comprehensive protection of children and preventing child abandonment. This NGO has a reach of about 15,000 children in Bolivia. Today, Maria Elena will be sharing her experience and knowledge on working with families at risk during lockdown and how future projects must respond to the needs arising as a result of the pandemic, anticipating future needs of families and offering effective support. Bolivia is a part of South America. It borders to the north with Brazil, to the southeast with Argentina, east with Paraguay and Brazil, and south with Chile and west with Peru. The pandemic in Bolivia has affected all sectors of the country. However, children and their rights have been relegated to the background regardless of the long-term consequences of this decision. The main concern is the stagnation of the educational system, deepening of social inequalities, and raising other problems and risks that have been previously contested. I'm now pleased to hand over to Maria Elena Ramirez for her to start her presentation. Thank you.
Good morning, everybody. It is an honor for me to have been invited by the Latin American Society of the Dundee University to be part of the series of talks on the impact of COVID-19 in Latin America. I'll be talking from my experience as a project coordinator and human rights expert working from an NGO and specialized in children's rights. Latin America is now the epicenter of the global pandemic. As a region, there was already a context of high level of informal work, inequality, insufficient health system, poverty, and high social risk on children, especially in low-income families. The health crisis has made even more evident the lack of stability, the low level of response from the government, and as a society to face this situation. The world is currently united as a shared struggle against an invisible enemy. But while eyes are focused on how to avoid and to treat COVID-19, the serious consequences that will challenge us far beyond the current pandemic, the so-called hidden impacts, are not yet evident. The available data does not directly include the impact of the pandemic of children. However, the reports presented on the context of coronavirus warn us of the disastrous impact of the crisis of children. Because of the pandemic, children have lost many of their rights: the right to education and information, the right to play, the right to privacy, all have been substantially restricted and at very short notice, with no time to prepare or adapt to the situation. Before entering the effect on COVID-19 on children, it is important to know that in Bolivia, 6 out of 10 children already suffers from one to several social risks. It is a country with high level of internal migration from country to the cities. Children are often exposed to inadequate housing situation, lack of basic services, such as drinking water or sewerage. intra-family violence and exposure to drug and alcohol use, among other risks. As you can see in the slide, social risks can be connected one with the other. For instance, unplanned pregnancy could lead to single-parent families that could also mean inadequate housing. Alcohol and drugs could provoke health problems or interfamily violence. Neglected childcare could also rebound in school dropped out or child mortality. The first measure to face the crisis in Bolivia started at the beginning of the year, with the interruption of face-to-face classes in all educational centers, including early childhood centers, special education, and regular schools. To understand a little bit better, a school year in Bolivia goes from February to October. This year, the government suspended school activities after 3 weeks of regular classes, with the promise of continuing with online sessions. However, schools were unable to start the system before June. Up until now, we are 155 days on quarantine, almost half of the year, and we do not have an ending date. Most likely, the quarantine will continue until vaccines are ready to implement. Education during the quarantine has presented more than one challenge. In average, families in Bolivia have 5 children in school age. Most of the families only have access to one smartphone, so classes are for the child who grabs the phone first. We cannot deny that because of the difficulty of accessing internet, Bolivia is one of the countries with the highest price of internet connection in the region. The government did try to create educational platforms without the use of internet data. They also prepare age-adapt programs that are broadcast in the radio and television. However, this new school has highlighted the low level of use of educational networks and online platforms, not only by parents, but also by teachers. In reality, what happened is that homework was sent to the parents through WhatsApp groups, some reading material, and no explication from the teachers. Sadly, this was the best scenario. I'm not only describing the situation on public schools, this also happened in most private ones too. With very few exceptions, country school ended the year without offering any kind of a strategy to solve the situation. They just stopped, and children were immediately promoted to the next grade, leaving their parents with the responsibility of their children's education. In low-income families, for most of them, the parents only have writing and reading level. Therefore, they do not have the conditions to be able to follow with the schoolwork sent by the teachers or fill in the gap in their children's needs of education. In countries like Bolivia, the role of the school goes far beyond the right to education. Schools are more than educational institutions. They are an important part of communities and hubs of social activity. School closures means that many children also lose social contacts. What we call the indirect effects are the great impact. This pandemic is having on children, but we are not really seeing it. Because of private schools have decided to continue this school year with the excuse that the bad system is better than no system, public and rural children are being left more behind in educational levels. This will have a long-term impact in access to universities or other forms of after-school options, which will rebound in access to higher paid jobs, quality of life, and can easily lead to increasing the poverty circle. But this goes beyond just school. Children under 5-year-old are not always taken into account, so their difficulties are invisible and therefore non-existent. The care, nutrition, and education that the child receives up to 5-year-old is vital for their development. Without early stimulation centers, thousands of children are growing up without access to adequate food, which will lead to health problems, reduce cognitive and language development for the next generation. So we're talking about for the next 10 years. All educational centers and kindergartens in Bolivia are part of state programs where children are given breakfast and midnight snacks. For most low-income families, this will be the only food their children will have during the day. No schools means no food, which means no more expense for the family. Based on available evidence, children do not appear to be at higher risk of COVID-19 than adults. While some children and infants have been sick with COVID-19, it is the adults the known cases to the date. NGOs specialized on children's rights have been receiving data that for each children under the age of 15 affected by this virus, there are 500 other hospitalizations related to malnutrition, domestic violence, or health conditions. Consequences from the absence of health control, vaccines, and preventing health care. Since March, health and dental control on children are not happening. They were organized by schools, as well as the social control for intra-family violence. The non-existence of economic income, the long duration of the quarantine, stress-related situations inside the family has had a direct consequence and worrying increase in the level of physical and emotional violence among the families. Because schools are closed, most children do not have the spaces to express themselves and grow safely. And because the public government experts bureaus dealing with these kind of problems are not working regularly, these complaint systems are collapsed, which result in children having to continue to live with their aggressors. The right to play have also been stripped away, leaving many children spending hours on the internet, if their parents can afford it, without a proper supervision, that have led to increased digital violence and harassment. It is also known that children are doing very little exercise. Families were told to stay inside. If we combine that with housing problems and overcrowding, children are growing in closed spaces with no privacy and insufficient space. This means they don't have any place to grow. There is also the working parents conflict. For the immigrant families, it's very common to only depend on themselves. They don't have any social network that could help them, and without any other options, they are forced to leave their children alone at home, which can lead to social risk such as abandonment. There is also the concern that children and young people from deprived families may not return to school after reopening. The severe economic hardship that many families are facing are pressuring children to work, to bring essential income to support their family, which is not only a violation of their rights, but also puts them at risk of contamination. I would like finally to talk about the psychological consequences in children with less access to information. Most of them won't be able to understand what's happening and will become fearful and potentially traumatized. When the quarantine started in Bolivia, there were only a few cases. Information was given to the families in Spanish, even though most of them speak Quechua or other language, and Spanish is their second language, so they don't really understand what was happening. They deliver information more in the sense of make them fear the virus, so quarantine is respected, than actually understand the virus and how to fight it. With information changing constantly and lots of misinformation, parents aren't always able to explain the virus to the children. And all the scary things that didn't happen the first couple of months started to happen once quarantine got too long. For families with day-to-day activities, staying home was no longer an option. After 3 months of enclosure, people started moving, and so was the virus. With all the scary things that they were told started to happen. Family, friends, neighbors started to get sick, hospital collapsing, and people that they actually know and people they're related to, they started to die in their own houses. This is creating stressful situations and trauma of children at the same level of a traumatic event. If we think a long term, the effects of COVID-19 can result in a developmental setback for the next generation. We know that in any crisis, the young and the most vulnerable suffer disproportionately. This pandemic is no different. Government should be able to ensure that decisions on COVID-19 are made based on the best available evidence in order to minimize and prevent any collateral damage and to provide mitigation measures so the damage is not lasting. We can only hope this actually happens. It is important to not let aside the fact that children are the hidden victims of the pandemic. The solution has to take into account the inequality gap and do not let increase the school dropout, but to encourage the importance of education and the role of school centers. Thank you very much. This will be my presentation on how the situation is affecting, that the COVID-19 situation is affecting on children. If you have any questions, if you have any concerns about what I just exposed, please, I'm open.
Hi, everyone. Thank you so much for that presentation, Maria Elena. So now we're going to move on to the Q&A session of the event. If you have any questions, if you could please send them through the chat. We also have some questions that have been sent before the event, so we'll give you a couple of minutes just to write some questions. Okay, so we're just gonna go to a question we got before the event. So the question one is, what measures can be taken to reduce the effects of COVID-19 in childhood? Maria Elena, if you could please give us some insight into it.
Yes, sure. The problems with taking measures on COVID-19 is that it's really hard to know how long it's going to last. For governments, actually the government in Bolivia actually had the problem that it's a transitional government. So it's taking measures that they are not really theirs to take. It's really hard to establish a public policy that could actually reduce the effects on COVID-19 with the transitional government. However, I do believe that we have to increase investments in now education. We have to prevent, we have to keep working on child protection, health, and nutrition, especially bringing water and sanitation. And this could manage, this could help in reducing the crisis. It is important to understand that children actually were let out of the school because they could bring infection and contamination into their own homes. But as I explained it before, the problem is now that children are working on the streets, are working on public markets. So they could easily be bringing the same contamination that they would have bring if they continued to the school. So it's important to reinforce also the information that it's been given to the families, because it's very clear that children may not die for COVID-19, but they bring the contamination to the family, the infection. And it's also important to know that they could have under kind of risk that undernourishment or any other kind of sickness that it could actually affect them. So it's important to keep working on the information that it's been given to the families, keep working on giving the information in the right language so they understand, and the children actually have a support system behind of them in case of any need.
Okay, thank you so much for your answer. Now we're just going to move on to a second question. So question number 2 is, what are the psychological effects of COVID-19 on children? I know you mentioned a bit about them during your presentation, so maybe if you could give us more ideas or any specific examples, just to let us know a bit more about these effects.
Yes, sure. As I mentioned it before, children are likely to be experiencing worry, anxiety, fear, And this can actually be a reflection of the fears that their own parents are very similar of what their parents are actually been affected. We could be talking about the fear of dying, of the fear of their relatives dying, or what it means to get medical treatment. Most of the children already have a problem going to the doctor because there were problems with how they were treated or how they understand the information. And now they are being told that hospitals won't even take them, that the help that they could get is not enough, and this could generate in a long-term process that children won't go to the doctor. They won't want to keep going to the doctor, even for the regular controls, or go to the vaccines, or they keep doing like dental controls. They could develop fear that could actually last long term. If the children don't have any sense of a structure and they don't know where they can actually go to get information or to get help, it could affect them in long term. Because if they don't have the information and they don't know where to go, preventive health systems wouldn't work. And it's much cheaper to work on preventive measures than working when something already has happened. So it's important to treat mental health and psychological health, and explain the children that this is not some sort of trauma that they're living, that it is a temporary situation and this will go on and everything will be fine. It's important for the parents too that they can give this information to the children, and they actually reduce the level of stress inside the family, because these levels of stress with the low incomes and all the difficulties that they have been having, this could lead to the intra-violence family that I was talking about.
Perfect. Thank you so much. And now this is another question we had. So obviously we've talked about primary school children, and now we just want to know what the situation is for high school graduates and their entrance to university in Bolivia. Obviously, it will be all kinds of school children that will be affected by COVID. So we just wanted to know a bit more about older children.
This is actually a very complicated problem, because we already had a discrimination gap, an inequality gap that was already reinforced because of public school and private schools. Most of the access of the university, it depends on an exam that the graduates have to pass in order to enter the university, and only the high grades can actually access to the university because the lack of space. So this gap that was already real, it was a problem for public schools because they didn't have the same level as private schools. So the problem that we're having is that the school year was closed, and all the students that were in the last year of school already graduated, so they are bachelors, but they do not have the knowledge that they need and that they require to pass the exam to get into the university. And the problem was that the government, when they shut down the school, they didn't put any policies behind it that could actually solve these problems. They are leaving it to the schools, they're leaving to the students to solve the problems of entry to the university. They have to study for themselves. However, they do not have internet connections. They do not have access to public libraries. They do not have access to the information. So it's been kind of a complicated issue, because they're supposed to be able to take a classes with the university that prepares them to get into the university. Universities do that so they could lower the bridge, the gap that exists. But this isn't happening either. So it's I think in the long term, it's going to repercute on the fact that public school students and rural school students are not going to get admitted into the university next year. This can discourage people. They will drop off of superior education and started to directly find a job. Sadly, this would also mean that the job they actually get access to would be the low kind. They won't have access to higher paid jobs because they don't have any kind of education or superior education, not even at the technical level. So this could repercute and return into the circle of poverty. They already have a context that is negative to them, and they will continue on it. So it's something that the government hasn't really talked about how to solve this problem. We're hoping that in the next couple of months, they actually offer some sort of access to education that could prepare these young men and then young women to get access to that. But I really do hope that the government could put some measure in place so this actually don't happen, that actually the students could get access to university.
Perfect. Thank you so much. And just kind of a question that I've thought about and we have just in there is, what are the current measures that the government has put in place to solve all the problems you've mentioned? So, like, how are they safeguarding the education of these children, or if it's even in their agenda to actually help out?
Sadly, it's not. All the measures that are being taken related to COVID-19 are especially focused on how to prevent and how to find some sort of treatment that actually works. We have a collapsed health system that's actually taking over all the information and is taking over all of the capacity of the government to solve the situation. And they haven't really been taking into account other problematics that are being having, social problematics. Children's were said, okay, you don't go to school and should be fine, but they didn't put any measure behind it. And as situation is that children are not dying, so they are not being taken care of. It's an invisible problem, and it's going to have a long-term repercussion. It's what we call the hidden impact of this pandemic. If the government doesn't take any measure, it should be up to the civil society to take action. But the civil society, NGOs, and other kind of foundations, they are also being affected because they don't have the economic resources to face the size of the problem. The problem was in the global situation. So NGOs that actually collected money from the northern countries are actually not getting enough money, so they could help the southern local regionals. So NGOs don't have the money to solve this, and they don't have the means to do it. The problematic is too big, so it had to be something done with the government and then with the civil society. But for now, nothing is actually being done. It's stuck.
Of course. So thank you for that answer. We actually have a question from an audience member, from Luis Mario Ramirez Borda. His question begins by saying, unfortunately, the education system in Bolivia is closed, but many children are still in risk because they have to work to help their families due to the economic crisis. What do you think of providing education via TV or radio or books in order to reduce disparity between the public and private schools in Bolivia?
Well, the problem with this is that the government actually did try to put in place some sort of educational measures through TV and radio. They actually did it. They even created online platforms, educational platforms that could actually solve the non-access to internet data. It's actually, the government did actually try to put some of these measures in places. There are programs going into television. They're age adapt for different children at different levels, so they could follow that. The radio is doing the same thing, even they're doing it in different languages. The problem is that parents don't always have access to a television, or they don't have access to a radio, or they just have to go and work outside all day. So children prefer watching some other thing instead of watching their classes. It's really complicated because children don't know, they have to be controlled. And just watching an educational problem doesn't mean that they're going to understand what they're watching. They have to have some sort of follow-up, and this is being led to the parents that they don't have the level required. Most of low-income families actually have only writing and reading levels, so they cannot be responsible for the education needs that the children needs. It has to be, they have to come from some sort of follow up with the teachers. It have to come from someone who actually knows pedagogy, and they know how to teach them, because parents don't only have the patience, or don't have the knowledge, or they don't know how to do, then they don't know how to explain it. It's actually very complicated because of this measure that the government are taking place, but they don't know how to implement them, or how to actually keep that they are actually happening, and the children are watching the programs, or listening to the radio, or doing the homeworks. Most of parents actually prefer that the children go out to work to help bring income to the families. And this is putting them at risk. It's a violation of the children's rights, and actually puts them in risk of contamination. And it's easier for the parents for next year to continue to their children, to motivate their children to continue working than going to school. So we actually have a lot of concern with the fact that there's going to be a higher level of dropout next year. This is actually a really, really strong concern that the government hasn't really put any solution to it. It's actually very complicated because there's no way to know if the school was they continue to do the classes, or they continue because they are immediately promoted to the next level, but they don't have the knowledge either. So it's going to create these gaps, and it's going to create frustration on children. It's going to create some situation that they rather quit school, go to work, and everything will be fine. But that's not the solution that we were looking for.
Of course. Now, just another question we have. Obviously, yourself, you work at an international NGO. So, just kind of wondering what the role of international organizations like the one you're with would be in the context where the government is not taking clear measures regarding the children and their access to education. Obviously, the government's bringing out all these kinds of like TV programs, but how can the international organizations help or kind of make rear kids into that education access?
Well, what civil society and the NGOs are actually doing is covering the part that the government is not doing in the measure what they can actually do. What the NGO that I work with did was, for instance, creating information in different language, and through WhatsApp videos that were actually not that. They didn't take too much data to be downloaded and watched, because that's also a problem, because you can find a lot of information in YouTube and other kind of chains, but parents don't watch it because it costs them too much. Access to internet is really expensive in Bolivia. So what the NGOs did was starting to work in easy messages, especially seeing that everything is going to be okay. You just have to follow the protocol. If you get sick, you do this. If you don't get sick, you do this. This is how you can prevent it. This is how you can take care of your children. Easy messages that actually that people can understand, and they actually help them get through the problem. because the government actually sent the messages in the sense of we have to have fear of the virus, we have to hide, we have to stay home, don't go out, instead of understanding what was happening, because it's not possible for all families to stay in quarantine forever. Most of these low-income families work day to day. They need to go out and work. So they cannot be afraid of going out. They just need to know how to do it, how to take care of themselves, how to protect their families. And they need to have this kind of information. And sadly, this information was not given by the government because it was passed on to the responsibility to the local authorities, and the local authorities decided what was best for each situation. And most of them, like I already said, it was given in Spanish, and Spanish is their second language. So they didn't really understand, and this was creating stress. This was creating a situation that they got under control. They couldn't even control it anymore. That's why the level of violence also increased. That's when the NGOs actually started to work in. They forced the government to open all the bureaus related to intraviolence families to resume work, even a long distance. Even if they're not working regularly, they were starting to work because it had to. And the NGOs put a lot of pressure on it because it had to be.
Right. Thank you so much for this very interesting Q&A. And now we are going to wrap up just the event. I don't know if there's anything else you would like to add.
No, I think, it's just, it's important when we read the news about COVID-19, or when we started to read the effects or what's going to happen, because everybody's actually very worried about the economical recession that's about to come, or how the economic it's been affected, or the housing, or the prices, or the work issues. We don't have to forget how this has been affected children's. They are the hidden victims of this pandemic, and we cannot let that happen. We have to ask questions. We have to ask the authorities. We have to keep seeing that the measures are taken, that the solution that they're giving actually takes into account children and their welfare, and that their rights are respected. It's important that if the schools are not working, the regular schools might not be working, because they might not work even next year, because we don't know how long this is going to be, that the measures are taking consideration how the children need these spaces, how children need to be able to socialize, need someone to talk to in case they have any problems, have a space so they can express themselves. So even if regular school is not working, there should be some sort of change that allows them to respect their rights and to be respected for themselves. I think that's pretty much it.
Perfect. Okay, so thank you so much for your participation today, Maria Elena, and thank you for our audience for joining us. We hope everybody has enjoyed the event and learned a little bit more about the challenges COVID has brought to children and its impact on education access in Bolivia. So for those who'd like to listen to this event again, or would like to share it with others, the talk has been recorded and it will be uploaded onto our YouTube channel, which you can find below, and our new website, where we also post all of our information regarding the monitoring COVID in Latin American project. So if you just go on sites.dundee.ac.uk/LAS academic, you can find more information about all the other chats we've done and more of the other countries we've also had experts talk about with us. And yeah, you can also find our other social media handles on this page. And again, please go to our website. And on behalf of the Academic Subcommittee at the Latin American Society, I'd like to thank the University of Dundee and the Institute of Social Sciences Research at the University of Dundee for helping us promote this event. And thank you so much, Maria Elena, again. This has been a really interesting talk, and I'm sure there's more to this topic. And thank you, the Academic Subcommittee, for your hard work. Thank you, everyone, and have a good afternoon.
Thank you for the invitation, and thank you everyone that actually participated. It's been an honor for me to participate on this project. I hope it was interesting for everybody, and if you have any questions related to rights of the child and human rights, I'll be open to help you out.
Thank you, everybody.
Thank you.